So I decided to interview a radiologic technologist, also sometimes referred to as an X-ray tech or a rad tech. So for the educational requirements, the person I interviewed said that you need to take all of the prerequisites for the program first, such as psychology, English, math, anatomy and physiology. There's usually a GPA requirement as well. For her, it was a minimum of a 3.4 GPA. And something she also noted was that different programs can require different levels of prerequisites, and also they can require different classes that you need to take. So not all programs are the same. When I asked her why she chose this profession, she said that her dad was the director of imaging, and before that he was a rad tech. So she'd kind of been around it before and always had known about it and was a little bit interested about it. She originally was actually a pre-dental student, but she switched to a rad tech position because she liked the idea of helping people out. And one thing I thought was super interesting that she said was that imaging is interesting and important because they are the eyes of healthcare. So for certifications and licensures, she said to get one, the program you are in will submit a paper that tells the ARRT you are able to sit for the boards. To sit for the boards, you need to complete 1,500 hours of clinicals and complete all educational requirements. And once you take that test, you must pass it with a 75 or higher. There's about 220 questions. And she said that you can take the test 3 times before you need to retake the program if you don't pass any of the tests. So for her, a typical workday is always kind of different because rad techs cater to the whole hospital, so it's kind of just who needs what. So they could go to surgery, med-surg, ICU, just anything depending on the day. She said that each day depends on the surgery schedule and procedures and who might need assistance. So for pros and cons, the pros for her, she said that being on call is kind of a pro and a con depending on the day for her, as well as it's a really rewarding job, and she likes that you can work with the whole hospital, and job security as well is great. As for the cons, sometimes the pay isn't always what you deserve. Sometimes imaging isn't always recognized or appreciated. The hours aren't ideal if you're working in a hospital setting, just because there's on call and it could be all hours just because they're always needed. And you do need to be physically in good shape because you're a lot of the times transferring and moving patients. And for advice, she recommends shadowing techs if you're interested, as well as just preparing for physics because there's a lot of that in the program, and learning about the program's requirements. So learning about the local programs around or just any that you're interested in and what classes they require or GPA and whatnot, because each program does vary. So it's good to know what each program requires.